right there.
We all want to get in on the Hovind press conference, but
We were wanting Gene Simmons here a minute ago.
Yeah.
is he here?
Just a couple of minutes ago, you missed him.
The heck! All right, that's my
You're
part of
gonna
my
vote on the Gene Simmons play?
part of my misspent youth. Yeah, listening to Kiss. Well, good afternoon. As you all know, we're going to have a vote this week on Thursday on a Democrat proposal to deal with the Biden COVID bonuses. And this is a vote, as you all know, we could have had weeks ago. It's been on offer now before we had to go through a 43-day government shutdown. But that's what the Democrats opted to do. And so at the end of the 43 days now, we're going to have a vote on their proposal, which, as it turns out, is really a proposal that just extends the status quo. Doesn't do anything to reform these Biden COVID bonuses in a way that would get rid of the waste, fraud, and abuse. And I think the one thing that's clear about this, and I think you all who follow this subject know this, that the way that the program is structured, the money goes straight to the insurance companies. And the way that we think this ought to work is you ought to come up with a way in which you can deliver the benefit to the patients and not to the insurance companies, and that you shouldn't have hardworking Americans subsidizing affluent people, people who make a lot of money. And that's what their proposal continues to do. There is no income limit. There are $0 premiums. There are millions of Americans who don't even know they have coverage, and they have decided not to do anything. Zero reforms to this program. And so the bill that they're going to put on the floor will fail. But that doesn't mean that there isn't a path forward here. We also will have a vote. Our members have decided that we're going to vote on a Crapo-Cassidy proposal, which does the things that I mentioned. It actually does make health insurance premiums more affordable. It drives down, according to the Congressional Budget Office, premiums by double-digit levels. It delivers the benefit directly to the patient, not to the insurance company, and it does it in a way that actually saves money. So to the taxpayer. That is a win-win proposal. So that is an alternative that we will put forward and that we will have a vote on Thursday. And we'll see where the Democrats come down on that. But the fact of the matter is that as long as we have been talking about this subject, and again, they drug us through a 43-day government shutdown in order to do this. Just in the last week, the Government Accountability Office came out with a finding in an audit that they did. There were 19 fraudulent claims made to this program, or 20 I should say, 19 got through. In other words, 95% error rate. When I say waste, fraud, and abuse, I am not kidding. That is the finding as recently as this last week by the Government Accountability Office. This program desperately needs to be reformed. The Democrats have decided we're not going to do anything to reform it, and so we'll see where the votes are on Thursday. But we will have an alternative that we will put up that reflects the views of the Republicans here in the United States Senate about how to make health insurance more affordable in this country, how to ensure that it's not the insurance companies that are getting enriched, that it's actually benefiting the patient, and how to make sure that this is a good deal for the American taxpayer. John Brasso.
So this week we are going to vote on a Democrat proposal to send $83 billion directly from the federal treasury to the bank accounts of insurance companies. And that is going to cause the cost of health care in this country to continue to go up. I'm a doctor, practiced medicine in Wyoming for 24 years. People need the care that they need from a doctor that they choose at a price they can afford. And that all went away with Obamacare. I remember President Obama saying, oh, if you pass this, your premiums will go down by $2,500 a family a year. Instead, premiums doubled. So what happened? Well, the Democrats wanted to hide these premium increases, so they said, we better send a lot of money directly to the insurance companies. Don't let the people see it. Send it right to the insurance companies. The insurance companies loved it. Premiums went up 221%. And the stock of the insurance companies went up 500% to 1,000%. That's what happened with Obamacare. And now at this point, over 90% of premiums are subsidized by the federal government. Obamacare was always pricey. It was never affordable. And then during COVID, people saw this and said, well, Democrats said, this is bad, prices keep going up, what do we do? They said, we need to put new subsidies on top of the old subsidies, and that is the Biden COVID bonus subsidies. Those are the ones that are expiring at the end of this week. What happened? Well, the Democrats chose that date for expiration, but they also removed any income limits. You can make $1 million a year and you're still getting all the subsidies from the federal government paid in your name directly from the government to the insurance companies. And now they want to send another $83 billion. That's going to be the vote this Thursday. They're not going to pay any attention to the reforms that are needed because of the waste, the fraud, the abuse, and the corruption. And in just today's Washington Post, the editorial in today's Washington Post, Obamacare subsidies make it too easy to scam the system. That's what's happening. This system is full of waste, fraud, and abuse because they make it too easy to scam the system. Well, I oppose sending these payments directly from the federal government to the insurance companies. They shouldn't be rewarded for what they have done. Money should go directly to patients so they can make their own decisions. And that'll drive down costs, make insurance companies compete to the people that are actually paying the bills, the taxpayers. Make them offer things that those patients want to have insurance, not held hostage in the straitjacket of the one-size-fits-all that is Obamacare that is hurting our country today.
Leader Thune, good afternoon. Can you speak to, for a moment to the political concerns